Good evening, everybody, and welcome back to my channel. Today, I will be talking about painful period, and I will also be talking about toxic shock syndrome. So, for painful period, the scientific name for that is dysmenorrhea. So, it's just a condition that some women, young ladies experience where there is severe abdominal cramps. There can be vomiting and nausea. It can be backache, and it can last for 1 to 4 days. So I have been through dysmenorrhea, or have experienced painful menses, and I know what it's like. I've missed days from school because you're pretty much you're in so much pain. You're sitting in the washroom, you're going from both ends. Like you're vomiting, you're having severe diarrhea, and you're having abdominal cramps. It's no fun. So I know what it's like to experience this discomfort. And it usually starts just like the day of your first bleeding, and it can go on for 4 days. It's worse on day 1 and day 2, I find. And it just really disrupts your regular routine. So I started period at 12, and I experienced it from the onset of my menses. So young girls can have it, older women can have it. So there's not anything physically wrong with you. So don't be alarmed if you're experiencing painful period. It can be treated, so you can go to your doctor and have that discussion about it. So it can start as young as when you just start your period, as I said before. As for treatment, I find heating pads work. So if you get some rice and put it in a old sock and tie the end of it and put it in the microwave for a few minutes so that it's warm, that's a nice little trick to get a nice heating pad. And you just put it on your tummy. You can put a towel there and then rest it on the towel so that it's not directly on your skin and it doesn't burn your skin. And it's just nice and warm and soothing. That's one way. If you have your formal heating pads, that's better. So do use what you have. But that really helps to soothe that area. Helps with the discomfort and the cramps. Eating a banana has potassium, so bananas will help with the cramps. So you can eat one banana during that time. Doing exercises, so I find that just standing exercise works better for me because I don't want to be lying on my back when I'm seeing my period. So I find that standing exercise helps to improve the flow and relax those muscles, and then that sometimes help with painful period. Chamomile tea is lovely. It's a tea that calms you, so it will give you sleep and it will also relax those cramps. So I find it's very, very soothing. So during that time, you can have chamomile tea, you can have ginger tea, you can have peppermint tea, and those are really, really, really helpful. So try that out. It also helps with the bloatedness. I know peppermint tea helps with bloatedness, and ginger tea also helps with bloatedness. So try these out, guys. So relaxing, sleeping, those also are some non-medicinal way of dealing with your painful period. Medicinally, so medications that you can take for a painful period is ibuprofen or Advil or Motrin. These are all the same things. They just have different names. So take your ibuprofen. It's recommended to take them at least a day or two before you know your period will start. The telltale signs are usually breast tenderness, and you might be constipated a little bit before your period. Those are usually signs that it's coming. And if you have a calendar, you usually can keep track if you have a regular period. So once you know that it's coming on, then you start taking your ibuprofen. You don't have to take it like 3 times a day, but at least start taking it so that it helps to reduce. There's something that your body produces during your time, that period time, and that ibuprofen reduces that chemical that is produced in your body. So that's why I'm saying take the ibuprofen a day before or 2 days before to help to reduce the cramps when your period actually starts. During your period, you can also take ibuprofen. Ibuprofen can be hard on your stomach, so make sure you're eating even crackers or toast or something light so that it's not just on an empty stomach. Okay? Another thing that I would recommend for young girls is I would appeal to mothers of young girls to take them to the doctor and get them started on oral contraceptive pills. This is a personal decision, but I would recommend, because I had to miss school a lot. I had terrible period pains. And if I had known about contraceptive then, I would have jumped at the chance to take it, because you can't, it just disrupts your life, and it's just not fair to that young girl to go through all this, and there are things out there that can help them. So have that discussion. It's not giving them license to go and have sex. It's just to help them to reduce that painful experience that they will have every month. So oral contraceptive pills, they have hormones in them, and they definitely help with the period pains. They also help with heavy bleeding, so that's another plus. Taking vitamins and supplements are also helpful. So if you take the vitamin B1, or if you take magnesium, or just take a multivitamin that has these in there, those can also help with those cramps and those discomfort during that time. Taking iron supplement is usually recommended when you're seeing your period, because you're losing blood during this time, and sometimes our iron count gets low because we're losing blood, especially if you're a heavy bleeder. So those are just some of the things that you can do to help with a painful period. So let's move on to the next topic, which is toxic shock syndrome. So what is toxic shock syndrome? So this is caused by a bacteria, and the bacteria the bacteria can enter your body when you insert a tampon. So you insert the tampon, and it introduces this bacteria deep into the vagina, and then this increases and then gets into the bloodstream and cause a severe harmful toxin to be released, and then it presents with all these life-threatening symptoms, and this is what we call toxic shock syndrome. So it can present with fever, diarrhea, headache, dizziness. It starts suddenly and it gets worse very quickly. So those are the signs and symptoms of toxic shock syndrome. So as I said before, when you insert a tampon, if your hands are dirty and you insert the tampon, if there's any germs or bacteria on this tampon, this is how the germs get into your body and cause all this issue. So if you leave your tampon in for more than, let's say, 6 to 8 hours, it increases the chance of having toxic shock syndrome. And if you're using super absorbing tampons, those also increase that risk of experiencing toxic shock syndrome. So, how do we prevent this from happening? You should wash your hands before and after inserting a tampon. Do not leave your tampons in for longer than 4 hours, at least 4 to 6 hours. And make sure you're changing them regularly. So don't leave them in for too long, change them regularly. So every more or less 6 hours. If you're going to bed and you're going to wear a tampon, you wash your hands, you insert a clean tampon to go to bed, and as soon as you wake up in the morning, you remove that tampon. So those are just some of the things that you can do to prevent toxic shock syndrome. So we have covered 2 topics today, and I hope you find this informative. Remember to like, comment, and subscribe. See you next time. Bye.